Hello, everyone. I'm Dr. Eberhard. I'm a pediatric neurologist, headache specialist here in Utah, working at Primary Children's Hospital. And in my practice, I do osteopathic manipulative treatment for my headache patients. So this is an introduction to what that is and why I just treat pediatric patients. At the end here, I'll kind of give you guidance of how you can find it more locally for you as well, if you're an adult as well. So if you ever kind of look at a doctor's name, they have either MD or DO after it. And so, as a DO, I'm a doctor of osteopathic medicine. So, everyone that goes to a DO school is trained in these things, but that doesn't mean everyone practices it. And very, very few who graduate from the medical school actually utilize it in their practice too, and take even more courses and advanced courses to learn and be better at osteopathic manipulative treatment. So osteopathic manipulative treatment or osteopathic medicine in general abide by four principles or tenets. The first principle or tenet is the body is a unit. A person is a unit of body, mind, and spirit. And so when you think about treatment of the health or of a person, you always have to take in mind that all these things are working together and it's just not about something physical. The second tenet and principle is the body is capable of self-regulation, self-healing, and health maintenance. And that's really important. And what I like to focus a lot in osteopathic manipulative treatment is allowing the body to self-heal. And that's very important. The third principle and tenet is a structure and function are reciprocally interrelated. So we'll kind of go that into more detail, but that is also really, really important into how the osteopathic manipulative treatment works. And so the fourth one kind of wraps up the first three principles and says rational treatment is based upon the understanding of the basic principles of body unity, self-regulation, and the interrelationship of structure and function. So to kind of just sum that structure and function thing about it, I always like to just come back to the old song you've heard before, like the hip bone's connected to the backbone's connected to the neck bone, and just think about how all these body tissues, everything, all the organs are connected in one way or another, and they do affect each other. How one part of the body, one part of the spirit, one part of the mind can affect everything else. Everything is connected. So the goals of an osteopathic treatment are to improve function. So we focus a lot on the anatomy and the physiology of the body to help improve that function. So we might remove a bone or a muscle or soft tissue restriction to, for example, we are improving just simple as a range of motion. So you have a frozen shoulder that's kind of stuck, then you just kind of help it out. We may just both focus on resolving a pain issue. We may just improve also the arterial supply to an area that's restricted. We may improve venous drainage or lymphatic return or relieve a nerve restriction. And a good example of this, if someone has heard like a thoracic outlet syndrome. So sometimes they have an extra rib that's compressing on nerves, blood vessels, and other tissues. Or you have a really tight scaling muscle, which kind of goes from the rib to the spine right here that's shown in the image right here, that these can also cause compressive vessels plus nerves. And so people would complain of every time they move their arm in position or their neck in a certain position, they get numbness and tingling, they get sometimes their color, they could get color changes, they get a decreased pulse, and they get pain issued with it like that. And so sometimes what osteopathic manipulative treatment is can help release some of that burden, that strictness and tightness, and all of a sudden you get relief off the nerve, relief off the vessels, and improvements in all those symptoms. So you have different terms to kind of know when we talk about osteopathic manipulative. So just we have osteopathic manipulative medicine as a general, and this is the application of osteopathic philosophy, structural diagnosis, and the use of manipulative osteopathic manipulative treatment or OMT in the diagnosis and management of a patient, while osteopathic manipulative treatment is the therapeutic approach of manually guided forces by a physician to improve physiological function or support homeostasis that has been altered by somatic dysfunction. And then it goes into, okay, then what is a somatic dysfunction? So we'll go more detail, but the general definition is impaired or altered function of related components of the body framework system, skeletal, arthroidal, myofascial structures, and the related vascular, lymphatic, and neural elements, characterized by positional asymmetry, restricted range of motion, texture and abnormalities, and or tenderness. And so this last little four things in that last sentence is pretty much how we define somatic dysfunction. So it's using our hands, putting on your a patient, and then finding tenderness, asymmetry, restricted motion, or tissue texture changes. And the more that we use our hands, the more we can gain understanding and knowledge by the feel and touch to actually understand what these tenderness, asymmetries, restricted motions like feel like. And sometimes there's more normal asymmetries, more normal restricted motions, but there's some like, oh, well, this is really abnormal. And so sometimes it takes a really experienced practitioner to really understand what is more normal and what is not normal. And then some of these somatic dysfunctions, even though you have it maybe in the toe, it can really affect the head. So, for an example, when we have a headache, a patient, this is a classic example that is has always been given me as a lecture. Is this one patient was being treated for headaches, and this person was finding stuff in the back, stuff in the hips, treating the head, creating him with these treatments, and did it. And it seems like he got better with his headaches, but always came back with more headaches, and just it was a cycle. So the doctor is just like, what's going on? And then one time when he was leaving, he noticed that there was an abnormal gait, like he just was something was hurting his foot. And finally, he just said, "Can you take a sock off?" And then guess what? The toe is infected. So we gave him an antibiotic. The toe got better for the toe infection. And guess what? The headaches got better. And so even something as small as a toe can change all the structures of the body because everything is connected that lead to a headache. So a lot of the somatic dysfunctions of how organs in the body are related can be kind of almost brought back to the spinal cord and just the nerves and neurons that are related to the spinal cord. In fact, we have a huge nervous system that regulates so much part of the body, and that is called the autonomic nervous system. And the autonomic nervous system is divided into two types. You got your parasympathetic nervous system, the rest and digest, and the sympathetic nervous system, which is the fight or flight response. So when we treat people, or when I treat people, and a lot of other practitioners, we like to focus a lot on the autonomic nervous system because it plays an important role in self-healing, regulatory, and as well as just regulating your blood vessels to help with that healing aspect, as well as relaxing your muscles to get out that fight or flight response. And it really focuses on that mind, body, spirit kind of approach, as well as just approaching a holistic approach. And so when you think about, well, then how do you treat the parasympathetic nervous system? So that's going to be more focused, like right here under the neck, where the vagus nerve 10 kind of comes out of the jugular foramen. So that's very important structure in our work. We're working on the sacrum because that is actually part of our parasympathetic nervous system that helps with, especially with that digestion portion too. And then you have to also balance what the components that work with the sympathetic nervous system. So that is more of your mid-back vertebrae between your first thoracic to your mid-lumbar region. And you also have your enteric nervous system, which is your stomach nervous system. And so you have ganglion or nerve body cells there because they're almost kind of, yeah, your stomach has a brain of itself. And that is part of your sympathetic nervous system. So it's important to think about how this autonomic nervous system is regulated by the brain, by the body, and how everything is related. Then you also have what we call the somatic nervous system. And so that is the everything else in your body that's not part of the spinal cord or the brain. And this is the nerves that go to your muscles or your sensory, like your skin and things like that, that go back to the spinal cord. So now we have to think about how these things are related. And so the somatic and autonomic systems actually, when they come together, they snaps in the vertebrae at the spinal cord at the same level, and they can share the same nerve pathway, and they can communicate with the same what we call interneurons within the spinal cord. So you can have with this right here, when you have a dysfunction within an organ per se, and it comes back to a certain level, like let's do an example of maybe a heart attack. So when people get like a heart attack, there's no pain neurons within the heart or anything like that, but yet the heart it knows that there's something wrong with it. So it goes back to the spinal cord where it gets a lot of its autonomic nervous system innervation. And then you have sensory nerves that innervate in that same area that are related to the shoulder, the jaw, and this area. So when people get a heart attack, they get what we call referred pain in these areas because they come to the same level of the spinal cord. And so we call that a viscerosomatic reflex, meaning the viscera, the organ, the soma, the body, and reflex, because there's actually something of sensory going back to spinal cord and affecting more peripherally. Okay, so that's important to kind of understand of how osteopathic manipulative treatment works because we are working mostly on the soma, but a lot of times we're trying to treat function as well by working the soma because we're going the opposite way. If by treating this the soma, the somatic portion like that, then we can reflexively go backwards and treat the viscera. So then, how do these somatic dysfunctions come about? So we are always developing somatic dysfunction, almost like every day we are doing it. And ever since the conception of birth, somatic dysfunctions are happening. You think about how traumatic birth can be, how much somatic functions that can create, from the asymmetry to plagiocephaly and all the other things. Like there's always somatic dysfunctions that are happening throughout life. And what we do over time is learning to compensate for them. So our body creates a somatic dysfunction and then we compensate. And it creates a somatic dysfunction, then it compensates. And then it creates a somatic dysfunction, then it compensates. And so almost everyone has compensations. And there is actually a natural way of grading compensations within the body, especially when you look at the structure of the body that kind of like alternates like this. And that's kind of a normal compensation of somatic functions where we usually sometimes see abnormal compensations where the body is just like almost all leaning one direction and you feel like it's like this. And that's kind of more of an abnormal type of compensations. But you also could think about these somatic functions that happen over time. They almost create layers like an onion. So they're all layering on top of each other. And that can be really hard because when we treat in, sometimes the underlying problem is layers upon layers within the onion of somatic functions, and sometimes it can be hard to find that true somatic dysfunction that it could be contributory to what's producing your headaches. So now, what is osteopathic manipulative treatment like? So you can treat you standing up, we can treat you sitting down, we can treat you lying down on the table, but that's the most common way because we want you in that rest to digest, relaxed position on the table, and so that's the easiest way to treat. And then your muscles and tissues and bones are examined for tightness, tenderness, and restrictions. And then the important part is we like to do gentle manipulation to stretch your muscles, to move your body and joints to relieve somatic dysfunction. And these manipulations may be slow, continuous pressure, or quick, sudden manipulations. And then the question people ask, oh, doesn't this like chiropractic treatment? Is it like massage treatment? Well, we'll kind of get into that, but I think the important thing to note is there's over 40 osteopathic techniques and treatments that require a heavy level of understanding of the anatomy, the physiology, and the application of which technique is most appropriate. And so that is the huge major difference that you'll see with a lot of people that have been trained and used osteopathic treatments versus one that uses everything and has the holistic knowledge of it all. Okay, so I'd like to just kind of simplify what it is. It's trained physicians use their hands to treat the twists and turns of the body's framework, which may come from disease, injury, or illness, allowing the ability to self-heal and function more efficiently. And if you want even more simple, using the hands to diagnose and treat the twists and turns in the body to help heal and function better. That kind of sums it up in simple terms. Now, when we're trained as these osteopathic doctors, we kind of like to divide these techniques that we use into direct treatments and indirect treatments. And I think it's important to understand this difference because it really does distinguish us with a lot of different other manual therapies like chiropractor. Because chiropractor would kind of only use a direct type of treatment. So In order to kind of understand the difference between use, I'd like to use an analogy, some analogies to kind of help you gain a sense of it. So direct treatments use activating force to move the tissues to the range of motion and to the barrier, and then try to go past that barrier or something like that to kind of free it up a little bit by like that. I kind of like to relate direct treatments to like disciplining your child when they have done something naughty. Okay? So you're like, no, 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 like that is something very wrong to do, and your child's like grumpy and like that, fine, I won't do it anymore. And so sometimes, that's actually a necessary treatment. Um, that's very, very helpful, and you can actually put a stop to that behavior because that was like a no-no behavior to do. But especially if you try to do that on a teenager, man, you're not going to get the same response and it's going to backfire on you. And that can happen with direct treatments. And so that's the thing to kind of beware of especially with maybe going getting a chiropractor treatment, something like that, that sometimes those direct type of treatments can actually hurt more than help and can backfire. And so that's why you have the principle of indirect treatments. So I'd like to compare, these are more putting a place the body into position of ease during the treatment. So it's like where the body actually wants to go, where it wants to do. Okay, so it's kind of more following the body itself and not trying to force the body into doing something it really sometimes maybe doesn't want to do. So I'd like to compare this type of treatment and principle to going to therapy itself, where you have a therapist more trying to just asking you questions to help kind of guide your thought process and see like and to help you kind of think about, okay, what do I need to do for myself? What are the goals that I want to work on? What are the things I need to work on? What kind of insight can I gain for myself? And it's not some forceful treatment, it's helping you develop that own insight. And then again, going back to that OSEA principle to allow that body to self-heal. And that's the principle of indirect treatments. And then you also have combined treatments that kind of take principle from both and to help within that treatment. And kind of dive into even deeper level to that, sometimes it's just important to listen to the body because there is a lot of self-healing that comes to listening. And I love this video. It's absolutely hilarious, but I think it really drives home the point like a nail.
It's just, there's all this pressure, you know? And sometimes it feels like it's right up on me and I can just feel it, like literally feel it in my head. And it's relentless. And I don't know if it's going to stop. I mean, that's the thing that scares me the most is that I don't know if it's ever going to stop.
Yeah. Well, you do have a nail in your head.
It is not about the nail.
Are you sure? Because, I mean, I'll bet if we got that out of there.
Stop trying to fix it.
No, I'm not trying to fix it. I'm just pointing out that maybe the nail is causing.
You always do this. You always try to fix things when what I really need is for you to just listen.
See, I don't think that is what you need. I think what you need is to get the nail out.
Listening now.
Okay, fine. I will listen. Fine.
It's just sometimes it's like there's this achy, I don't know what it is. And I'm not sleeping very well at all. And all my sweaters are snagged. I mean, all of them.
That sounds really hard.
It is. Thank you. Ow!
Oh, come on. If you would just
Don't.
Try to see things my way.
So I hope that made you laugh because it always makes me laugh every time. But there's so much truth to that, not just in relationships, but also in how we listen to our own bodies and how even though someone who practices osteopathic medicine listens to the body as well. There is a self-healing component that helps a person feel better that comes with just listening to the body. And that is like a very indirect method of treating someone. So you can look at all these, we have names for a lot of these different techniques. And so you're like, look at this slide right here, like, whoa, what is that? The only thing I'd like to point out on this slide is that while osteopathic medicine is trained in so many different techniques, you have people who have trained with osteopathic doctors, then have developed their own trade that kind of is very focused and selective too. For example, There's the founder of chiropractic school, who's Dr. Palmer, actually studied under the founder of osteopathic medicine, A.T. Still. And while he was kind of more interested in more this magnet therapy, he took those skills of what we call high velocity, low amplitude, and applied it to a lot of the treatments that you focus on the thoracic. So he actually took a technique from osteopathic medicine that he learned and applied it to chiropractic school. So chiropractic focuses a lot on this more direct type of treatment, where you have people like in physical therapy, they have taken some of these other direct treatments and they apply a lot. So some of the physical therapists I've met have used muscle energy. They have used soft tissue treatments, myofascial releases in their treatments. And then you have people that are called craniosacral therapists. And so this kind of school was thought, or in the 1970s, was founded by an osteopath that trained under someone who really founded cranial therapy within the osteopathic field. And his name, if I remember, was Dr. Starts with an L, but I can't remember right now. But he founded craniosacral therapy. So he took a lot of these sacro-occipital techniques or cranial techniques and sacral techniques, and they created, there's a school that was created out of it that uses this very selective type of techniques. So let's kind of think about how we kind of approach and think about it. So we think about what kind of anatomy is related to the head itself. So we think about how can I treat the head based off the anatomy, the physiology, and you have to think even sometimes beyond the head. So you have to think what's on the lower extremity, and is there any pelvic symmetry that's going on? And then we have to think about even the TMG, because that sometimes is very involved in our headache medicine too. So you have to think about all the muscles are related in there too. So your jaw muscles are like the masseter, the pterygoid muscles, the temporalis, and then for the head and neck, you have all these muscles right there too that are involved. And then you have to think beyond muscles because there's something called fascia that is involved. And fascia can be really connective, that they can actually connect from the bottom to the pelvis all the way up the head. And if you think about if you have like hypermobility and connective tissue disorder, have how that's stretchy and easy like that, and how that can get affected so easily and lead to pain in the more than one place. Um, then you have something called with when we talk about the refer pain, and so you have a lot of places that have refer pain. So you're like, even though the pain is right here in my head, or the front of my head, sometimes even that's like sometimes how occipital nerve blocks work is treating the back of the head and stuff like that. How does that hit my front prime? Because we have all these kind of refer pain points, and that sometimes they're called and referred to as myofascial trigger points. And you think about kind of the anatomy, so a lot of even concussion research is kind of focused on there's different theories how it works, but maybe the autoregulation of how drainage happens through the head, whether it's the blood vessels, and then maybe there's actually damage to something that's called the lymphatic system that is related to concussion. And so maybe having a focus in headaches and migraine and these concussions, you have to really sometimes focus on getting that toxic stuff out of the system because maybe especially in a concussion aspect that's a little bit broken or not working as well. And so we need help that venous flow. We need help that lymphatic system that helps just get all that toxic stuff that's accumulating in your brain, especially with that lack of sleep, to just kind of help get out of the system again. So that's a lot of stuff to think about. Now, let's just kind of walk you through a case I had last year of how I treated someone that kind of nothing like truly magical curative, but kind of gives you kind of a thought process of how, on a more realistic basis, how this is interplayed within someone that who comes through osteopathic treatments. So this is a case of a young female that had new daily persistent headache following a concussion. And she has not had any headache freedom for over a year, and medication was only helping minimally. And her baseline headache was of a 6 to 7 out of 10. So when I take a patient like that, I kind of have a systemic kind of approach to it, how I take of it. And then sometimes I then have like if I feel like something's needed more than another, or I feel like I'm guided that this person needs this kind of treatment, I take a little different directions too. But this can be kind of more of a common experience for someone that just enters my clinic first time of what they might experience. So sometimes what the first thing I do is really focus on the autonomic nervous system. So I do some techniques where I'm doing some what we call soft tissue or myofascial releases that are surrounding the celiac ganglion nervous system. So it's me pretty much putting my fingers right in the middle of your tummy. That's really what it is. And then just kind of slowly kind of feel those tissues, and I'm waiting for some like those tissues that are restricted to just release. And part of that releasing just allows for that bounce with an autonomic nervous system. And I do that with also with rib raising because that sympathetic chain ganglion is right next to the ribs near the spine. And so by doing these rib raising techniques right here, I can actually stimulate that sympathetic nervous system. And by stimulating, sometimes I can actually get it to calm down too. Just kind of be like, ooh, ooh, okay. So then I can do that. Then I can also work on that vagus nerve. So as it comes down out of the jugular foramen right here, if I work on the back of the skull right here and work on releasing these tissues that are affected within the back of the skull, and sometimes I also decompress the skull off of the vertebrae, we call that a decompression right there. They can relieve a lot of that pressure and help have more vascular flow from the jugular a vein, more better flow from the carotid artery, and then release tension within that vagus nerve that kind of goes to that jugular foramen. And so that can be really important to kind of start that balancing of the autonomic nervous system. Then I try to say, okay, is there anything else below the head that could be affecting the head? And so I sometimes just take a toe to head approach. Like, is there anything else starting from the toe that I should be work on? Okay, so a lot of that is more focused, if anything, on the pelvic sacrum, because when you think about the anatomy of the dura membrane, which is all the pain, where all the pain nerves that produces your headaches or migraine attacks, is usually mostly in the dura, stuff like that. It surrounds the brain, goes down the spinal cord, and actually attaches to the sacrum. So the sacrum is a very important part of the dura that all surrounds everything. And so any asymmetries or dysfunction within that pelvic structure that attaches to the sacral structure, it can be very important to treat that to help relieve the whole system. So I focus on that, and then I kind of go also focus on the diaphragm, because the diaphragm, it also plays a role in the autonomic system, because how we breathe can, if we breathe more shallowly, that can affect and have you have a more of a sympathetic nervous system. But if I can get you to relax your diaphragm muscles to allow you to take more deeper breaths, that can actually help you bring more of that rest and digest nervous system as well. Okay, so we focus on those kind of things too. And so then as I kind of go up the spine, find any kind of more spine dysfunctions too, I can then get to the neck and I kind of maybe just soften the neck tissues, give you a little nice massage there. And then I kind of focus on the vertebrae segmentation there and just kind of really try to do some balancing of the tissues there. And then so I do a combined direct and indirect treatment that seems to be really good at relieving any of the tightness or restrictions that are in the vertebrae itself. Then sometimes I like to repeat that occipital like that, just to make sure, because really that's what people love the best. They say it feels so good to have that occiput just decompress off the vertebrae. They love it. That's like that. And in fact, there's even devices out there. You can buy like devices that sit on the back of your skull that massagers use too, that just help naturally really cause that decompression as well. Then I might like focus on some muscles, like in the shoulders and stuff like that. And then for a lot of those, I like to use a technique called counter strain. This is an indirect treatment where I actually take the muscle, and then try to shorten the muscle by changing the position of it. So for the trapezius, in order to shorten this muscle, I have to bring the shoulder up, all like that. So to shorten that muscle right there. But the thing is, if I shorten the muscle through my own will and contract the muscle myself, that is not going to reset the tone and it's going to stay tight. But if I have the patient relax completely and I take it and move it into the position while the muscle is still relaxed and hold it there for quite some time, like about 90 seconds, that actually can reset the tone of the muscle so that when I put it back to position, it's nice and loosey-goosey now. So those are some techniques that I could use there. And then I kind of focus on the TMJ, so all the muscles are there, trying to use various different types of techniques to kind of help really kind of release all those restrictions and somatic functions from the jaw. And then I might also do what's called the venous sinus release. So I actually kind of work with the cranial bones around what we call the venous sinus drainage system, which I'll show you some pictures of that later, what kind of that looks like. And then at the end of my treatment, I just listen because that is also very important. And sometimes in the listening, your body tells me that it needs some other type of treatment, and I go and do that thing, and it can guide me. Okay? So here's kind of example of how what we do with the skull. So we have different really areas within the venous drainage system of your brain. And so we have an important point where it all kind of comes together in one place, and that is right at the back head, and it's called the inion or the confluence of the sinuses. So we find that that's kind of more the most important place to treat because that's where everything comes together before it goes back out of the head. So we focus on that part, and then we can focus on what's called the occipital sinus, kind of going underneath that confluence right there. We can also do that condylar decompression, which is kind of similar to the occipital decompression to kind of help the transverse sinuses as well, is what we work on too. And then we also work on the straight sinus by just using two different components beneath the skull and on top of the skull to get that straight sinus, which is in more the middle of the skull of the brain itself. And then we work on the superior sagittal sinus, which is here, top right here. So you have these huge sinuses that drain a lot of the blood from your head that we're just trying to help the venous drainage system from your head to get all that toxic waste out of your brain. So now I did a lot of this treatment, and so let's go back to my patient and how she did with this kind of more preaching approach. And so when she left the first visit, there was no improvement in headache, but the left pain that I treated that she was having was better. And the next visit that she like that, she said, "Yeah, I've never had problems with my left hip since you treated that thing. It was just like it was a miracle. It was good." I'm like, "Great." Okay. So then I did it again, a similar approach to this patient where I took a lot of these same scales right here, and I then just changed things a little. And then I did something different that I focused on something that's called the myelodura bridge that can be impacted in a concussion because it's my muscles that are underneath the skull right here attached to the dura itself like that and try to stabilize the dura. And so there's a special technique that kind of focuses on releasing that. And like that was one of the major differences I took in this technique approach that I think that made the difference. And so when the patient left, she said, "Yeah, my headache feels better. It's now at 5, 6 out of 10." And then when I asked her how things went at the next visit, she said that first day, and when after I slept, I woke up and I had a no headache for a whole day, and this was like a miracle for her. It's like wow. But then she said after that, then it returned, and it was but the baseline pain was so much better as a 3 out of 4 out of 10. And she was like, "This is amazing." She wanted to continue. It's like she really wanted to work with that. She was motivated because this was really cool. So then we tried to take similar approach to the third visit. No change in the pain. And when I saw her on the fourth visit. And after the fourth visit, we had to go our separate ways. So I never saw how after the fourth visit was. But after that fourth visit, she said, "Yeah, my sleep's better, my stress better, and I just feel so much better overall." And so it takes also the aspect of body, mind, and spirit that it's not just about treating the pain in the headache itself, but we're trying to treat the whole body, the whole function. That a lot of these treatments are focused on helping you. So another way to think about these treatments from visit to visit is yes, I helped that hip pain, but maybe that was the first somatic dysfunction that really needed to be treatment. That was one layer in the onion that we talked about at the beginning. And then that myelodura bridge that I focused on the second visit was another layer. And now it has to be sometimes layer after layer before some things can get really true better. And then we're always again building so as we try to peel layers away, sometimes life just hits another concussion happens and we're building layers onto each other. So it's a hard thing like that we deal with life, but that's part of the osteopathic treatment is just help you relieve some of those layers layer by layer to see if we can get you back to your wholeness, your health, and what is most important to you, your well-being. So then you're asking, okay, then how can I find someone that does this? And so there's different websites can help you find more specialists. So there's people who more specialize in that more cranial aspect of osteopathic medical treatment. And so you can go to their kind of academy, which is Osteopathic Cranial Academy, and find a listing of those who more specialize within that field. And we can go to a more of a generalized osteopathic doctor and find those, which is find a DO at osteopathic.org. And then you can find people that are trained in more of that listening aspect that I have that, and that's more traditional osteopathy. And so they have a directory with people that have that as well. In fact, you can just Google OMT Utah or put in your city or something location you, because I've done it on several places trying to find, okay, who are OMTs in this area, who are OMTs there, like that I can refer people to. And I do find some people. And so that here and there, they're almost hidden, but if you search, you can find. In fact, there is two DO schools here in Utah. There is the Norda in Provo, and then there's a Rocky Vista, which is near St. Gervais. I think the town is called Ivan. That's in. And so that those are schools that um, train in osteopathy, and usually what they have is an osteopathic office that a lot of the teachers at the school use to help their patients, and so you can actually use patients or be a patient at some of these clinics that are associated with the school. And then if you find a doctor that it has done a fellowship in something called neuromusculoskeletal medicine, that means they're extra specialized in OMT because they did a year of just training and training just for that type of medicine itself is to be a better doctor in OMT. So if you find someone that has that fellowship, you're in good hands. Now, the hard thing with this is insurance is sometimes not good at recompensating doctors for this treatment. So sometimes the best OMT out there are more cash only TPU because they have no we know that the reimbursement for what we do if that's what you do every day Monday through Friday the reimbursement you're going to get in a regular doctor's office with under insurance is not going to be enough to support that office and so they sometimes go cash only and so someone like me what that does it, I only can do it like maybe 1 day a week or something like that because the compensation I get is not going to be really financial helpful for me in the long run unless if it's supported by everyone in the group too. And so that kind of makes things challenging too, to why we don't see it as often practiced as we would hope it for to be. But they're out there and they're ready to help you. But you sometimes have to put the work and effort to find them too, of someone that's able to help you. And this is where I'm going to end my presentation, and we can go with questions.